Hey, this is Brandon Steele with ChiroUp. Let's talk about auto accidents. More importantly, the patients that come to our office after an auto accident. What we know from the literature is that 83% of people after an accident have a whiplash injury. Of those, over half still have pain a year later. Even more concerning are the people that have neurologic issues after the accident. Of those people, over 90% have symptoms after the first year. But I'm not here to talk about those. I'm here to talk about that 10%. That 10% of people that don't have neurologic issues. We do an MRI, we do an X-ray, and there are no structural findings. What do we do with those patients? How do we justify our care, long-lasting chiropractic care, usually aimed at the spine, if there are no structural changes in the spine? This becomes difficult. Now, we know from the Canadian C-spine rules who we should image and who we shouldn't image. However, after 4 weeks, if they're not getting a certain percent better, we need to be doing imaging. A lot of times they're positive for degeneration, for disc problems, for foraminal stenosis. However, let's talk about those patients who have continuation of pain and don't have those findings. Because now it becomes difficult for me talking to the patient, but also talking to the lawyer, and then the lawyer talking to the actual judge or the case of what is going on with this patient and why they're not getting better. We need something else. In this case, there's an awesome paper by Lawson, just came out 2020. Here's what it says, is that there are a lot of times facet joints get irritated. The cool part about that is the facet joint is part of the spine. It's not a muscle, it's not a ligament. Because if I went to the court and I said a year later they still have a sprain or a strain, that's a tough argument to make. However, if I can find a reason why the spine is causing their pain, it's much easier. So here's what they proposed. Do an injection. Do an injection of the facet joint and see what happens to their spine. I've included a graphic here on this blog for you to look at, because normally when you have facet irritation, it's going to be segmental. You're going to get a characteristic pattern dysfunction that goes in the cervical, thoracic, shoulder blade area. Normally is unilateral, not going past the shoulder, and it's chronic and it's unrelenting, even in the absence of structural dysfunction. So here's a great way for you to use an advanced imaging, advanced technique, in this case, an injection, to help justify your case, to bring some causation to what's going on to both you, your patient, your lawyer, and maybe an insurance adjuster, and to figure out what you can do about it. However, there's another ancillary benefit to this, is that when you can start to use facet injections, you can build a network of like-minded practitioners, in this case, an interventional pain management doctor in your area, that can help you with these cases, and hopefully continue to build that relationship with attorneys in your patient's best interest.